Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, doctor. Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So basically, the brains use tiny electrical signals to control everything we think or we feel and do. A seizure happens when a person's brain is overloaded with abnormal amount of electrical activity. Some doctors also describe seizure as a storm in the brain, or even uh, during a seizure, a person might lose consciousness, shake or convulse, become confused, or even feel sudden fear or panic. These are all the various presentations with which a patient can present during a seizure.
What are the different types of seizures and do they affect people differently?
Yes, there are different types of seizures. They depend where the unusual activity starts in the brain. So, what I mean is that where the electrical activity, the amount of electrical activity which is more, where it starts. So, it depends on the place where it starts. So, based on that, you have many seizure types of seizures. So we usually classify seizures as either generalized or focal. So if you have a generalized, it starts off in whole of your brain, and that is the entire brain. So if you have a seizure starting at a particular place and then it is spreading to whole brain, then you say that it is a focal seizure. So these are basic categorization. You divide them into two, generalized or focal, and then based on where it starts off, you have lots of semiologies, that is lots of symptoms how they present.
What is epilepsy?
Yeah, that's a good question. So most of the patients have this doubt: is it a seizure or an epilepsy? Is Epilepsy is nothing but multiple seizures. Actually, is a medical condition that causes a person to have repeated seizures. Generally, a doctor will diagnose epilepsy if someone has at least two unprovoked seizures. So, meaning you have only one seizure, you call it as seizure, one unprovoked seizure. But you have two unprovoked seizures, then you call it as an epilepsy, and you need to evaluate for it. So either it is a structural cause, or you need to find the cause. So while epilepsy can include many different types of seizures, while some people only have one type, others may experience more than one type.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Yeah, that is very important. It is normally taken that you have cause for every epilepsy, but it is not always. So for about half of the adults with epilepsy, we may not find a specific cause. But for the other half, the common causes includes stroke, like elderly people with stroke or Alzheimer's disease can present with epilepsy. Then the others include common things include genetics, also has a common role. Researchers say that certain genetic factors likely to develop epilepsy. So
Got
others,
it,
so
got it.
yeah, and I did I mention the others including many infections in the brain. That those are also commonly seen, and patients who have head injury, who have a fall and have head injury also can present.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
See, symptoms can vary a lot, as I was telling when regarding the focal and generalized. See, focal seizures usually it depends where the location is in the brain, from where the seizure originates. So This includes sudden becoming behavioral arrest. We call behavioral arrest. The patient suddenly starts staring or does not respond to our commands. Suddenly they start jerking the limb, probably one limb or sometimes both the limbs. And then sometimes they present with sudden fixing of the hand. That is, they do the grip thing. They just fix the fisting. Sometimes they fall down all of a sudden, feeling losing the consciousness, and sometimes you start off feeling with a strange feeling. So usually all these can present, and sometimes it leads to a generalized condition where they fall down. They have up rolling of eyes. And then they start moving both the upper limbs and lower limbs.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, that is a good question. Yes. Unfortunately, epilepsy has been misunderstood for a long time. Historically, people didn't realize that epilepsy is a neurological condition and myths developed around it. Seizures can look frightening, so people may react with fear or even avoidance, which leads to stigma.
How does this stigma affect people with epilepsy?
Yeah, regrettably, individuals with epilepsy often face negative attitudes and discrimination from others. And I've seen many patients who don't even come out of their house because of the stigma. They don't go to schooling, they don't, and few women who are at home, they don't get married. Uh, and then children, when they have epilepsy, the co-children in the classroom don't even mingle with them, don't play with them. So all these are seen. So research has shown that stigma can increase the frequency of seizures also.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, this is very important. Triggers vary from person to person. So we need to know what is triggering and then try to avoid that so that we can control the seizures. And medication obviously will help. So few triggers which we know already are when they miss the sleep, and then they obviously the body is stressed. See high stress levels again because of any reason, work or because of any reason at home. Flashing lights, yeah, when you go to a place where there are a light flashing, like in functions or any music places. So all these flashing lights and the sounds. Sometimes the sounds are also provocative. Then meals, food, that is very important. You need to have a regular food intake. And missing food is also a trigger. Fever and illness, yes, definitely you have to be very careful. So you have a fever high grade, it definitely will trigger seizure. And definitely coming to the last point, you should definitely not miss the medication. And in women, hormonal changes during the menstrual cycle also can trigger.
Okay.
So it is better to maintain a diary where you note down. You note down when you have a seizure, what duration you have a seizure. That will help us to manage it better.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Several healthy habits can reduce the risk factors. So I always encourage getting enough sleep. The first main thing, sleep, as fatigue is a major trigger. And the next thing which we can easily do is like eat regularly and balanced meals, staying active. So go for a physical exercise every day, at least 25 to 30 minutes a day is good for any individual, not only in epilepsy. So physical activity is generally safe. It's good to avoid extreme or high risk sports though. But then if you really have to go, then you can talk to us, your doctor, and then get the advice. Managing stress is essential, and that could mean practicing relaxation techniques, talking to a counselor, joining support groups.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
At home, it's wise to clear away things that could cause falls or cords or clutter, and to pad sharp corners of the tables. So, if you fall down, see that you don't hit any sharp objects. Use non-breakable dishes and consider using a microwave when you should not use the stove when you're alone. That is better. Also, placing soft carpeting can help reduce injury when you have a fall or so. These precautions are simple, but it will definitely make a difference.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course.
Yeah. Just remember, with the right treatment, many people with epilepsy can manage their condition well and lead full lives. So, being aware of triggers, practicing healthy habits, and having support make a big difference in this. And remember, you are not alone. There's a community of support out there.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.